Beware 20 medications that cause memory loss. Many people around the world are using medications every day. Some of them are using painkillers, antidepressants, antibiotics, sleeping pills, etc. But you should know that according to the latest statistics, prescription drugs cause over 100,000 deaths per year and place nearly 1.5 million people in the hospital due to severe side effects. And the real and ugly truth is that many of these prescription drugs and medications are rushed through approval before the drug's patent runs out, leaving not nearly enough time for adequate testing and causing a host of problems among the public. You should be very careful. These are the top 3 types of drugs which can cause memory loss. Top 3 types of drugs that cause memory loss. Note before we start, you should know that some side effects of these drugs are so bad that they have been found to affect the brain and cause memory loss. Here we cover the 3 categories known to cause memory loss and cognitive problems. 1. The anti-drugs. You should know that some prescription drugs and medications such as antihistamines, antidepressants, antipsychotics, antibiotics, antispasmodics, or antihypertensive, inhibit the activity of the neurotransmitter acetylcholine, which plays a critical role in memory and cognitive function. And the worst thing about these drugs is that many of these drugs are available over the counter, therefore causing even further damage to those who have not had proper doses measured out for them. 2. Sleeping pills. The medical experts claim that the most common side effect of sleeping pills is both short and long-term memory loss. Well, a recent study has found that all sleeping pills produce some level of impaired memory and performance. These medications actually suppress the action potentials of a wide variety of brain cells and reduce our alertness, vigilance, and judgment. You should also know that sleeping pills have been known to create a state similar to blacking out, which occurs when a person has too much alcohol in their system and are unable to recall previous events due to damaged brain cells. 3. Statin drugs. The Food and Drug Administration highly recommends that all consumers and professionals to monitor their use of these cholesterol-lowering medications due to reports of cognitive impairment and memory loss. The medical experts have found that this drug can cause patients to feel fuzzy or unfocused in their thinking, along with a sudden frequency of feeling forgetful. 20 meds that cause memory loss. Note you should be well informed on the risk of these prescription drugs. So just take a look at the list of medications known to have memory loss as a side effect. Interferons, high blood pressure drugs, insulin, lithium, barbiturates, amytal, nembutal, seconal, phenobarbital, chemotherapy drugs, for Parkinson's scopolamine, atropine, glycopyrrolate for epilepsy, phenytoin or dilantin, painkillers, heroin, morphine, codeine, sleeping pills, Ambien, Lunsta, Sonata, benzodiazepines, Valium, Xanax, Ativan, Dalmane, quinidine, beta blockers, especially those used for glaucoma, methyldopa, antipsychotics, Haldol, Mellaril, tricyclic antidepressants, naproxen, steroids, antibiotics, quinolones, antihistamines, alternative solutions. Note if you are using any of the medications mentioned above or find yourself exhibiting any signs of memory loss such as getting lost, undergoing sudden changes in mood or behavior, or having difficulty following directions, asking the same questions repeatedly, forgetting common words when speaking, then you should definitely consult with your doctor. Well, you shouldn't be worried because these side effects are temporary and will lessen and eventually stop once the medication is removed. And make sure you eat a diet rich in brain-boosting nutrients, stay active and focus on positive thoughts. We really hope you find this video helpful and don't forget to share it with your friends and family. Thank you.